Hi, I'm Eoin Murphy and I'm a junior doctor working in the HSE at the minute. Doctors, nurses, all healthcare workers put our bodies in the line to treat the most sick and vulnerable people in our society. We are your sons, daughters, neighbours and family members that rush forward to treat when others have been asked to stay inside. We need the state to fully back us in our fight against the coronavirus. Nothing short of a full lockdown should be demanded at this stage. All but non-essential economic activity should be ceased. A moratorium should be placed on mortgages, loans and rent, while emergency sick pay extended to all. These measures in place, we hope to flatten the curve and reduce disease burden and hence mortality of this pandemic. Healthcare workers should be able to work in settings which are completely compliant with all contact precautions advised by public health. The rationing of personal protective equipment for fears of shortages puts health workers at risks, and this is unacceptable. We treat the sick, but without protection we can easily become the sick and also vectors of the coronavirus. With 15,000 being the figure quoted by An Taoiseach to get the virus by the end of the month, we need to acknowledge the enormous pressure this will place on our healthcare system, especially the ICU beds. I agree with Leo that it is a national effort and we should be all in this together. We should see the resources of the private sector deployed for public use to mitigate against the worst pressures of the virus. For us to fight the disease effectively, we need to guarantee supply of personal protective equipment and medical equipment to hospitals and workers. This should be done by the state running and coordinating of the production of ventilators, face masks, gloves and alcohol sanitizer. A public problem requires a public solution. Private hospital beds and pharmaceutical labs should be requisitioned and put to immediate use in fighting the worst aspects of the COVID-19 virus. Any profiteering by private companies on what is required by the public health of the country is unconscionable, whether this is for the use of crucial ICU beds or the acquisition of ventilators. An emergency fund for bolstering the HSE should be used to recruit and cover the costs of healthcare workers picking up extra hours and shifts and being redeployed into other services. We are calling on the government to take measures that will inspire confidence in healthcare workers and also in the public. Time is not on our side. Every second counts, so we need to act fast.